Thank you, Devin. And according to the CDC's National Hospital and Ambulatory Medical Care Survey, stomach and abdominal pain, cramps, and spasms are among the top reasons that people go to the ED each year. And even higher yet are chest pains, coughs, and cold or flu. So, Nurse Christina, thanks for joining me this morning.
Hi.
Always a pleasure to see you bright and early.
Thanks, glad to be here.
So we have a few things to talk about this morning, and it's around nausea and vomiting. Is that right?
Right. Yep. Absolutely. And like you said, you know, it actually there's more cases of stomach issues that go to the ER than even chest pain, which just blew my mind.
Yeah, that is baffling right there. So let's get right into it. So what are some of the main causes of nausea or vomiting?
Right. So, you know, nausea is just that discomfort feeling. It's just you're feeling yucky, not quite right. And the vomiting is when you actually, an expulsion of your contents of your stomach. So there are two different things, and you can have nausea without vomiting. But some of the big causes, you know, right now we're seeing a lot of rotavirus and norovirus, and those are what we used to call the stomach flu. That's what they are. And they usually last a few days and then kind of work their way out. There's also food poisoning, excessive alcohol drinking, you know, we were just talking about Beef-A-Rama. So some of them may have felt kind of yucky the next day. Of course, pregnancy, acid reflux is another big cause. And just motion sickness, dizziness can also cause it. And then migraines are another big cause of nausea and vomiting.
Now, nausea and vomiting, we talked about having nausea without vomiting. Could you have vomiting without nausea?
I suppose you could if it was something that just all of a sudden happened really quick. But you'd have to be, I would think, pretty sick to just all of a sudden vomit, you know, without having any precursor.
Yeah, that would probably draw some questions, I'm sure.
Yeah. So I would think it would be something, a little more serious if that was the case.
Well, so how is it evaluated and treated if you do happen upon this nausea and, expulsion? You know, I'm sure it's not something that anyone really dreams of having.
No, and it's the worst feeling. You know, I know people will talk about breaking out into sweat or having chills just before the vomiting occurs. And, you know, you can... one of the things they will do, of course, is just a physical. You could call your doctor and go in for a physical exam where they would look at you, maybe even draw labs to see if anything is off and try to find the root cause. They can also, if it extends, I had a patient yesterday who called and said that he has had nausea for months. And so with someone like that, with this prolonged nausea, they're gonna go and do an upper GI. So they'll do a scope that goes down into his stomach to see what's going on in there. Can also do x-rays to see, is there a small bowel obstruction or something going on in the GI tract. Yeah, feeling uncomfortable in your own body there can just really be disrupting. Right. And once they find out the cause too, then there's treatments. There's medications that you can take. Your doctor can give you like meclizine and phenagrin and some of Reglan, some of those, Zofran. They'll give you those. They can order. And then there's just things, you can do at home. So if you do think it's something like norovirus or rotavirus or pregnancy, eating a bland diet is really good. Staying away from spicy foods, making sure that you're staying hydrated. You can use things like beef broth. And I know Campbell's even sells the bone broth now in those sippable cup things. So you can do that. Gatorade, drinking fluids that have the electrolytes in them, rice, crackers, bread, and even, ginger can help. You can buy ginger tablets, you can put ginger in your foods. I actually make an immune shake or drink that I've been using this time of year that has ginger in it to just help keep away all the the bad germs. But again, avoiding smells that are really strong, and maybe taking medications with your meals. So if the nausea and vomiting, we were talking about medication management. If the medications you're taking, I know metformin is a huge one for that, and people will say it gives them a lot of GI distress. So does Ozempic. But taking the metformin with food can help with that. So there are some things you can do.
Well, that is always good advice. And when, after all this, should you be calling your doctor?
Right. So typically when symptoms last greater than 2 days, so you've been vomiting greater than 2 days, if you're starting to have chest pain or belly pain along with it, if you're noticing that you're vomiting blood or what you're vomiting looks like coffee grounds, really dark, those are more serious. Yeah, you want to get in. If you're having bowel movements that have blood, or the same thing, the coffee grounds, you want to talk to your doctor. Any fever, if it gets higher than 101, severe headache, stiff neck, you're just feeling tired or weak, that can also be a sign. With kiddos, we get worried if they haven't had a wet diaper for greater than 6 hours. Their eyes will get sunken, the soft spot on the top of their head will get sunken in. Fever greater than 102 with the kiddos. If they're crying without tears, that can be a warning sign, or just unusually drowsy. So those you want to go in and talk to your doctor about right away.
Those are good things to be on the lookout for, especially as we, this is all important, because we are heading into the cold and flu season. So some of these things you might be seeing a little bit more frequently now. Like you said, those immuno shakes. Those might come in handy this time of year.
And kids are back in school, and so they're sharing everything and touching everything, and hands go in the mouth.
Yeah, the kids going to school. It's like a germ factory over there. So, it's just always good to be alert, know what to do, and when to get help.
Wash your hands. That's another big one. Make sure you're washing your hands using your hand. Actually, with nausea and vomiting type things, you want to use soap and water. The hand sanitizer won't work for like norovirus or rotavirus. So
good advice. Well, thanks so much for coming on this morning and talking us through this. Always appreciate your time. And we'll have more What's Trending for you right after this commercial break.